Mr. Speaker, the 2024 annual meeting of the Bermuda Drug Information Network, otherwise known as BerDIN, was hosted by the Department of National Drug Control on November 1st at the Bermuda Underwater Exploration Institute, BUEI. This was the 15th meeting of this information network. Mr. Speaker, the BerDIN is comprised of individuals who either represent themselves or an agency, with the objective of delivering factual, impartial, and comparable information regarding alcohol, drugs, and alcohol or drug addiction in Bermuda, along with their repercussions. The meeting was attended by 31 BerDIN members and invited guests, which included 20 professionals from the Bermuda Addiction Certification Board. This year's meeting was the first collaborative effort between BerDIN and the Bermuda Addiction Certifications Board, BACB. Mr. Speaker, the gathering facilitated discussions and allowed participants to gain insights into the developments that occurred on the island over the past year, presenting a comprehensive overview of the current situation regarding alcohol and drug use in Bermuda. Mr. Speaker, stakeholders attending the meeting represented both governmental and non-governmental agencies, such as the Bermuda Hospitals Board, the Bermuda Police Service, Bermuda Sport, Anti-Doping Authority, Department of Child and Family Services, CARTA, Department of Corrections, Department of Court Services, just to name a few. Mr. Speaker, I, as Minister of National Security, under whose remit the National Drug Control now falls, commenced the event with opening remarks, which were followed by presentations from experts in their respective disciplines. This year's agenda focused on updating members regarding the latest activities and initiatives from agencies involved in both demand and supply reduction efforts. Participants also had the opportunity to hear from an international guest speaker who addressed emerging trends in drug use. Mr. Speaker, there are significant health and safety concerns arising from the misuse of alcohol and drugs that I would like to highlight for your consideration. In the initial presentation led by Mrs. Joanne Dean, the director of the DNDC, the achievements of BerDIN were emphasized and appreciation was expressed to the members for their ongoing support. Key insights were communicated concerning the data outlined in the 10 chapters of the annual report. Notable points included alcohol, cocaine, and marijuana continue to be the three most preferred substances, with users indicating that these substances are easily accessible. A significant number of individuals sought assistance from Turning Point, Salvation Army, and Men's Treatment. A total of 5.5 million liters of alcohol were imported, with a valuation of $30.7 million. This importation generated $19.3 million in custom duties. Additionally, there was a significant increase of 53.9% in the number of individuals who did not pass the breathalyzer test. Mr. Speaker, concluding the presentation, Mrs. Dean addressed the significant data gaps identified in this year's report and the various organizational challenges that agencies have encountered over the past year. Furthermore, she urged the members to persist in their vital efforts to collect high-quality data despite current circumstances. Mr. Speaker, Officer Jermaine Galloway from Texas delivered a comprehensive presentation regarding the latest drug trends observed in the United States, Canada, and now Bermuda. The day before his presentation, Officer Galloway performed an environmental assessment of various local stores to evaluate the Bermuda drug market. Attendees were shown a series of images and videos depicting the different drugs that are appearing in stores across the island, such as kratom, microjelly, amentia, mascara, shisha, THC, M, THCO products, and Synpacks. These go between the teeth and gums. Mr. Speaker, he also addressed the harmful effects these products could have on our community, particularly in terms of marketing strategies aimed at young people, the high potency of items, and the use of vape devices. Many of the identified items are synthetic cannabinoids or precursors to more potent synthetics that may arrive on island as part of trans in the USA, and many are in bright packaging and flavored, thus potentially attracting our youth. The representative from the Department for National Drug Control, or DNDC, Stephanie Tankard, who serves as the research officer, delivered an update regarding the department's 6 survey initiatives, which included public amenity, treatment demand indicators, consumer experience, employee experiences, stakeholder feedback, and drug abuse monitoring, servicing. A detailed summary was presented regarding this drug abuse monitoring survey. Mr. Speaker, it was emphasized that alcohol, marijuana, and cocaine are the 3 most commonly used substances among people who are sentenced to incarceration. Notably, for the first time, 8 people tested positive for morphine upon reception into the Department of Corrections. Additionally, 12% of inmates upon intake reported using prescribed medication for mental or emotional issues within the last year. Reports of physical abuse, sexual abuse, neglect, and abandonment before the age of 18 were made by 20 inmates. Furthermore, drugs and alcohol were linked to 23.9% of both current and past offenses, and 14.5% of inmates indicated they experienced an intermediate to severe drug abuse problem. Mr. Speaker, Dr. Celeste Maycock, an emergency room physician, presented a collaborative initiative between the Bermuda Hospitals Board and the Department for National Drug Control. This anonymous study aimed to investigate the types and prevalence of substances consumed by individuals involved in road traffic accidents who sought treatment in the emergency room from May 1st, 2023 to April 30th, 2024. Key findings revealed that out of 167 participants, 16% female, 84% male, aged 16 to 90 years. 119 individuals, or 71%, tested positive for substances. Among these, 53 participants, or 32%, had only alcohol in their system. 32, or 19%, had only drugs, and 34, or 20%, had both alcohol and drugs in their system. The positive drug test identified substances such as THC, cocaine, methamphetamines, benzodiazepines, and or opiates. Notably, 20% of accidents occurred on Fridays, followed by Saturdays, and a significant proportion of the road traffic accidents were single vehicle incidents, or 62%, predominantly involving motorbike riders, which was 81%. Mr. Speaker, Mrs. Nadine Karkos, a government analyst at the Department of Health, presented several case studies from the past 2 years in which alcohol and or drugs were possibly related to death. She detailed the analysis of drugs found in toxicology reports and DUI samples. Mr. Speaker, in 2022, following the suspicious deaths of 48 males and 11 females, the substances identified included ethanol, alcohol in 9 cases, drugs in 15 cases, and a combination of both alcohol and drugs in 13 cases. Additionally, there were 22 instances where no substances were found. Among the female cases from 2022, the presence of cocaine, fentanyl, norfentanyl, and morphine was noted in one individual's blood. In the male case study, substances such as sopanim, citalopram, tramadol, oxycodone, and codeine were detected in both blood and urine samples. Mr. Speaker, in contrast, in 2023, the analysis of substances following the suspicious deaths of 51 males and 12 females revealed similar findings. Ethanol or alcohol was present in 9 cases, drugs in 20 cases, and both alcohol and drugs in 5 cases. However, there were 29 cases where no substances were detected. Mr. Speaker, in 2023, the analysis of substances following the suspicious deaths of 51 males and 12 females revealed similar findings. Ethanol or alcohol was present in 9 cases, drugs in 20 cases, and both alcohol and drugs in 5 cases. However, there were 29 cases where no substances were detected. Mr. Speaker, Chief Inspector Robert Cardwell from the Tactical Support Division of the Bermuda Police Service delivered a presentation on the procedure for conducting roadside sobriety checks and the relevant legislation that underpins this practice. He also outlined the legislative amendments he has proposed, which are aimed at enhancing the authority of BPS officers during vehicle stops and addressing public awareness regarding the timing and locations of these sobriety checks. Mr. Speaker, the final presentation of the day was delivered by Dennis Lister III, JPMP, the chairman of the Bermuda Road Safety Council. His presentation centered on the initiatives and strategies aimed at combating impaired and substance-related driving. Mr. Lister highlighted that a significant number of accidents are linked to alcohol or impairment, primarily caused by drunk and or drugged driving, speeding, distracted driving, and reckless behavior. He emphasized the negative effects of impaired driving on our close-knit community and stressed the necessity for behavioral and cultural changes to achieve meaningful progress. Attendees were reminded of the various short and long-term campaigns and initiatives established to tackle impaired driving. In conclusion, Mr. Lister outlined the anticipated outcomes and objectives of the Bermuda Road Safety Council. Mr. Speaker, the 2024 annual report on the BerDIN and all the presentations can be accessed on the government portal. We encourage policymakers, stakeholders, and the community to utilize the data to direct actions and or program development to address any areas of concern. Thank you, Mr. Speaker.